I would like to review maybe very quickly the other antibody-drug conjugate with phase 3 data in the HER2-positive field, which is called TULIP. And this was, as I said before, around my phase 3 trial with another antibody-drug conjugate, Trastuzumab Duocarmazine, or SYD985, which were compared against treatment of physician's choice in TN1 or at least 2 prior therapies in the metastatic disease. Primary endpoint was progression-free survival, and the hazard ratio was 0.64, statistically significant, but the median moved from 4.9 months to 7 months without a signal in survival, based also on the toxicity profile with eye toxicity reported in 78% of patients being grade 3 or higher, 21.2%, ILD in 7.6% of patients, and 2% fatal cases. I think this drug is going to be tough to be used in the clinical practice. I don't know its role after TDXD. Maybe I would like to make just brief comments also about another important study, which is the KEYNOTE-355. We presented the final overall survival data. Remember, KEYNOTE-355 is a first-line randomized phase 3 trial in triple-negative breast cancer patients with chemotherapy plus Pembrolizumab or chemotherapy plus placebo. Co-primary endpoints were progression-free survival and overall survival, first in the PD-1 positive populations measured with a CPS score 10 or more, and afterwards CPS score 1 or more, or in the intention to treat population. You know that the progression-free survival was statistically improved when Pembrolizumab was combined, and at ESMO we presented the overall survival data. Amazing data, in my opinion. Hazard ratio 0.73, 0.009, and the median overall survival moved from 16.1 months to 23 months. So an median improvement in survival of about 7 months, which I think, in my opinion, is something of clear interest and might be considered another option for patients with PD-1 positive triple-negative breast cancer in the first-line setting.